Good morning.
Good morning.
Good morning, Jim. Now, guys, before we continue, does anybody have any questions? No. So far everything is clear? Okay. So today we're going to start talking about the bones of the skeleton. Okay. So what we can say about the skeleton is yes, now roughly speaking, I mean just for it is to make it easier to discuss it. We can say that the skeletal, well, let's put it this way, that the skeleton is divided into two parts. Now, one is going to be what we'll call the axial skeleton. And what we mean is we'll have an axial skeleton is going to be, we can say bones of the skull, face, the entire spinal column, and the ribs, and sternum. Okay, so these are going to be the part of what we'll call the axial skeleton. So pretty much as bones of the skull or the cranium, bones of the face, and all your vertebrae of the spinal column, fused or unfused, are going to be in your axial skeleton. Then we have the 24 ribs and the sternum or chest bone. There's also going to be one little unique bone, and that's going to be what we'll call the hide bone. Okay, guys. Now, what is going to be unique about this bone here is it is the only bone in the body. Not that. Okay. Doesn't form a joint with another bone. Oopsie moops. So this is going to be the only bone in the body that does not join or forms a joint with an other bone. Is that clear?
Yeah.
Good. So please make sure that you note that. So the hyoid bone, the only bone in the body that doesn't form, or yes, okay, makes a joint with another bone. Now, guys, the other example is okay, the other part of the skeleton, if that's what you want to call it, is going to be, it's okay, what we'll call the appendicular skeleton. And that means it's okay, going to be, it's okay, we can say it's okay. Okay, yes, the upper extremity. Plus, what we will call, yes, okay, the shoulder girdle. And, okay, yes, bones of the lower extremity. Plus what we call, yes, okay, bones of the pelvic girdle. Is that clear?
Yep.
Any questions?
No. What's the word after skeleton?
Here,
Yes.
upper. Your upper extremity, which is, okay, what
Okay.
you can call it upper extremity, you can replace the word extremity by limb, whichever. They're both the same, okay? Did that make sense? Yeah.
Yes, it did.
Okay. So guys, here, yes, okay, you can actually see, yes, okay, your appendicular skeleton. So whatever is okay, as red or brown or maroon colored, that is going to be, yes, okay, your appendicular skeleton in this here. So yes, okay, we have the shoulder girdles, and then we have, okay, as the bones of the upper extremities. We can say, as okay, we have the pelvic girdle, and then we have, okay, as the bones of the lower extremities. Is that clear?
Yeah.
Good. Where up shit the hell? Sorry guys, I don't know what happened here. Okay. So you guys can see, right? Okay, where is okay? The axial skeleton is okay, the bones and the of the skull and face, all the bones of your spinal column. Even guys, that's okay, the sacrum, all the, that's okay, we can say, that's okay, the sacrum forms the posterior border of your pelvic cavity, but it's okay, it's not going to be, it's okay, a part of the pelvic girdle. Is that clear? Okay. So yes, okay, bones of your face, skull, your spinal column, your ribs, and okay, yes, your what do we call, yes, okay, the sternum or chest bone. Okay. And okay, the unique bone that we even talked about was just okay, the hide bone. Which is going to be is okay, somewhere right here. But okay, yes. Did you guys get that? Or physically, yes, okay, in the human, right here. That's where you actually is okay will find the hide bone. Okay, right here. Right. So what actually is okay now since it's not what you want to call it, yes, okay, held in place by okay as being joined to another bone, it is actually is okay going to be as okay the muscles in your neck that holds that bone in its position. Okay. But that was the only bone in the body not to be joined by another bone, as they may call it, as okay, articulating with another bone. Okay. Yes. Now we can mainly say that the exoskeleton is going to be as okay a total of 80 bones in the exoskeleton. Okay. Now we will mainly as okay talk about them as okay, yes, we can say it's okay, the cranial bones. We may also as okay talk a bit about as okay the bones of the face. So you can say okay, that will be as okay the facial bones. Okay. And we may as okay talk about as okay the ribs. We may talk about the vertebrae. And at last but not the least, as okay, we will talk about as okay the fellow called the sternum or chest bone. Now the cranial bones, guys, they're going to be as okay 8 bones. Okay. And there's going to be as okay a total of 14 bones that makes up the face. Here. Now let us just look at the okay, let's go this way here. Use this program. Oh God. So you guys can see this fellow here. Okay, guys. So what we can mean says, okay, your cranial facial skeleton. Now this big bone here that makes us, okay, your forehead. That is going to just, okay, be called the frontal bone. Is that clear?
Yeah.
Or if you go down here, this fellow here, that's going to be as, okay, your frontal bone. That makes up the forehead. This is going to be as, okay, the parietal bone. Then we have, yes, okay, the occipital bone. The bone that is making your, what you want to call it, okay, the back of the head. We then have, yes, okay, what they call, yes, okay, the temporal bone. And then we have, okay, that's what we call, yes, okay, the sphenoidal bone. Okay. These are going to be, yes, okay, the bones of your cranial bones. So the frontal bone in adult life, yes, okay, this is one bone. In infantile life, yes, okay, this used to be two bones. You have two temporal bones, you have two parietal bones, you have one single bone, which is going to be the occipital bone, and then we have, yes, okay, the sphenoidal bone. Okay.
There's two sphenoid bones, right?
How many?
There's two of the sphenoid
Sphenoid bones?
Yes.
No, it's one bone. Yeah.
Wow.
Right. But the easiest way to do it is frontal, occipital, parietal, temporal, and sphenoidal. Okay. So frontal, or you can go like this. You can go frontal, parietal, sphenoidal, temporal, occipital. Did you guys get that?
Yes.
Okay. So these are your cranial bones.
Just a question. Is
Yeah.
the ethmoid, isn't that one too, or is that facial?
Now the ethmoid bone, that's going to be a facial bone.
Okay. So that's 7 or 8?
It's 8 bones, my dear. Okay, guys. Now, if we just, okay, well, okay. Okay, guys. And or yes, okay, if we just look inside the skull. Okay, so what they actually is okay, or what they actually is okay did in this diagram here was that they removed the top of the skull. Okay, but we can still see it's okay that we have our bones. As we as okay may notice, so this is going to be as okay your frontal bone. Is that clear?
Yeah.
Okay, this is your frontal bone. Now this, that's okay. The call is okay. This butterfly shaped bone. That's actually is okay going to be the sphenoidal bone, and that's mainly as okay where we see the lateral side of the sphenoidal bone here. Is okay what you will call the temples. Is that clear?
Yeah.
Okay. Then we can say, okay, these here. These are your temporal bones. Okay. Which we as okay, mainly as okay, just that's just the lateral side of it. Okay. Now here's okay, me is okay because they have removed most of it, but this me is okay. We can say it's okay, just the remaining of your parietal bones, which was this fellow here. Okay, so you can mainly say it's okay. They mainly is okay had made a section through the skull, yes, okay, at this level here, and okay, remove the top part, mainly so that we can see it's okay inside on the skull, inside of the skull. And what we see here is actually as okay the occipital bone. Right, okay. Now back in the days, I mentioned as okay something that we call as okay the foramen magnum. So you can maybe say okay, the foramen magnum is okay, that is what you find in the occipital bone. And it actually is okay through this foramen magnum here that okay, as you can see, it's okay, the brain stem connects to the spinal cord. Did you guys get that?
Yeah.
Okay. Right. Now there are some other smaller foramen and so on, so on. So you don't need to worry about those. Okay. Is that clear? Okay. So as far as okay, as you know your bone, the frontal bone, sphenoidal bone, temporal bones, and okay, as the occipital bone, and okay, as your parietal bones.
Mike, I'm only counting 7.
Same.
Let me see.
Because the ethmoid's on there on the skull.
Let me see. Okay. That should be a bone of the facial skull somewhere, anyways. Okay. Okay, yep, sorry. admiral bone. Okay, so let's check it out of facial cranial bone. Okay. Okay, yeah, sorry, yeah. For the admiral bone, let's see. Okay. I don't really know what I'm sharing with you guys. And that's medius. Okay, what do you see here? So it's actually okay, and bone in the orbit. Okay. They put it as okay as the facial bone or cranial bone. Sorry. Or if you look at the front view, this dude here. Oh, what do you mean? Okay, let me find here. That's the admiral bone. Okay, thanks for that, dear. Okay, guys. Now, what you may see, or if yes, okay, if you just look at the bones of the cranium. Anyway, as okay of your facial skeleton. Okay. Now these are going to just okay be joined together. Because you can say it's okay, you have the frontal bone. As okay, is going to just okay be joined together by the parietal bone through yes okay this kind of joint here. So that's going to just okay this zigzag line here. That's okay. This zigzag line here. That's actually just okay the joint between your frontal bone and the parietal bone. Okay. You may even say it's okay that yes okay you have the parietal bone and okay yes it's going to be joined by or to the occipital bone. But okay yes this joint here. Okay, so the bones of your, let's do it this way. Oh, I hate this program so much. Let's do it this way. So we can mainly say that the bones of the cranial, which comes from cranial and facial skeleton, are joined. Together by immobile joints called sutures. Is that clear?
Yeah.
Right, okay. So where we actually can say that these were going to be sutures between, yes, okay, the bones of, yes, okay, well, okay, for here is going to be, yes, okay, the cranial skeleton. But likewise, yes, okay, they're going to be, yes, okay, these immobile joints of the bones of the facial skeleton as well. Okay. Now, guys, the only mobile joint of your craniofacial skeleton, the only mobile joint of your craniofacial skeleton is going to be, yes, okay, the joint between the temporal bone and the mandible. Or it's okay, your lower jaw. Okay. So that's going to be, as okay, the only mobile joint of your facial or craniofacial skeleton. Is going to be the joint between, yes, okay, the temporal bone and the mandible. And that's actually, yes, okay, what we can call, yes, okay, the temporal, from temporal mandibular from mandible joint. Clear? Now, some people may also, yes, okay, abbreviate it as the GMG.
That's the one that's movable?
That's the only joint of your, yes, okay, maxillar or craniofacial skeleton that's going to be mobile.
Okay.
Okay. Okay. Just try to, yes, okay, move the joint between, yes, okay, your frontal bone and temporal bone. That's not going to happen. Okay. Try to move the joint between, yes, okay, your occipital bone and parietal bone. That's not going to happen. Unless it's broken. That's a different story. Okay. But, okay. So the bones of the craniofacial skeleton are going to be joined together by immobile joints, where we say, okay, that there's going to be completely no movement at all. And those joints are going to be called sutures. Did that make sense?
Yes.
Yes.
So they are going to be, it's okay, completely immobile suture, that's okay, joints between the bones of the, not only of the cranium, but it's okay, of in your face as well. Okay. Now, guys. So we can mean it's okay, just say it's okay. We can just write our exception here. Okay. And the exception, or we can say it's okay, except from the temporal mandibular joint. Right, okay. That was going to be, yes, okay. This joint here is okay, that was going to be mobile. And luckily for that, yes, okay, because that's yes, okay, how we, yes, okay, may open our mouth. And hopefully, yes, okay, also going to be able to, yes, okay, close it down. Right, okay. Now, guys, the sutures. Okay. Okay. So we mainly as okay, we'll say as okay, that mainly as okay going to be 3 sutures that we mainly as okay just will name. Now the first suture is going to be as okay what we'll call the frontal suture. Okay. Okay. So the frontal suture that is going to be considered okay the joint between. Now, which bone is it, or which bones is it that's going to be joined together by the suture, which is okay, an immobile joint that will be referred to as the frontal suture. That is going to be as okay your frontal bone. And the parietal bones. Did you guys get that?
Yeah.
Okay. So here, this suture line here. Or even it's okay if you go here and say it's okay. This suture line that runs between, yes, okay, the frontal bone and okay, as we can say, the right parietal bone and the left parietal bone. This is going to, yes, okay. Some people call it a frontal suture, some people call it the coronal suture. Okay. Okay. So that's one of the sutures. So anatomically, you can mean it's okay, what runs here is the frontal or the coronal suture. The suture between the frontal bone and just okay, your 2 parietal bones. Is that clear?
So frontal and coronal, they're the same suture.
Yeah.
Okay.
So that tells you that's okay. Why do they call it okay the frontal or coronal plane? I use yes okay because it runs along. It's okay. It's a plane around. It's okay the frontal suture, or they call it a frontal suture, coronal suture because it runs along in the line of the coronal or frontal planes. Is that clear? Okay, guys. Then we can see the next suture is going to be as okay, what we'll call as okay the sagittal suture. And again, yes, okay, what do we mean by the sagittal suture? Well, okay, it's going to be, yes, okay, the joint between. Now, we can here says, okay, the right and left parietal bones. That suture line is going to be called the parietal, or it's going to be called the sagittal suture. Did you guys get that?
Yeah.
Okay. So we can mainly say as okay, right parietal bone, left parietal bone. And in the middle is going to be as okay, a suture line that joins these two together. And if you look at okay, it runs on the sagittal plane. So that's going to be referred to as the sagittal suture. So whether the name of the suture is okay after the plane or the plane after the suture, we can discuss from now till doomsday and may not be able to just okay agree upon that. Clear? Did you guys get that? Good. Now our last suture that we may be talking about is going to be as okay what we will call the lumboidal suture. And again, guys, we can say as okay. Suture, of course, as okay, that's going to be as okay, the joint between. Now here is going to be as okay, the parietal bones. And the occipital bone. Did you guys get that?
Yes.
Unfortunately, but we can mean it says, okay, up here at some point, yes, okay, that's where you have the sagittal suture because the right parietal bone, yes, okay, will join with the left parietal bone. But then, yes, okay, at the back here, yes, okay, we can actually say that. This here. That joins us, okay, the parietal bone with the occipital bone. This suture is going to be called the lumboidal suture. Or we have it right here. Or if you look inside the skull. Okay. This here is okay, that this is the occipital bone. This, and for instance, okay, this here is the parietal bone. So this suture line that runs between is okay, the occipital and parietal bone.
Are you trying to show us the PowerPoint picture?
From the, that's why I hate this program. Sorry, guys.
That's okay.
Yeah, you can see now?
Yeah.
Okay, good. So This was your occipital bone. This green bone here, that was the occipital bone. And we can say, okay, this is what is left of, okay, as your parietal bone. So this part here is, okay, that will be, this suture line here is, okay, that will be your lombardial suture. Or even as, okay, if we went here, sorry. This was the parietal bone, the occipital bone, and okay, yes, in between those was going to be what we call the lombardial suture. Is that clear?
Yes.
Yeah.
Okay, so mainly we can say as, okay, three suture lines that we would okay, don't worry about it, Kristen. Okay, three suture lines. The coronal suture or frontal suture, sagittal sutures, and the lombardial suture. Clear? Good. Any questions?
No.
Or just look here. Okay, I have some better slides on the book. Oh, can you guys see my PowerPoint?
Yep.
Good. So let's just say that this was your frontal bone. So yeah, and these were your parietal bones. And back here, okay, that's the occipital bone. The frontal bone and your two parietal bones, you have the coronal suture. Your right and left, left and right parietal bones, the suture between that is going to be the sagittal suture. As okay, between the occipital bone and your parietal bones is going to be as okay, the lombardial suture. Did you guys get that?
Yeah.
Good. Now, guys, if we just okay, take the skull. Like this, and just so we know, yes, okay, what we have, yes, okay, this is the anterior side of the skull. This is the posterior side of the skull. So that's okay. What we may have here is, we can say, is okay, a nose. We can say that, okay, yes, the frontal bone. So right now, yes, okay, we are looking at the skull from above, right? Okay. We can say it's okay, we had a parietal bone and a parietal bone. And we also had the occipital bone. Okay. What we mainly say is okay, from the joint between here, there was the coronal suture. Our main is okay, forms a joint between, oops, these two here, okay, will be the okay, sorry. That is the suture. And what mainly is okay from the joint. Here is okay, there was the lumboidal suture. Now, guys, in adult life, yes, okay, these suture lines here are fused together. Now, what we may find in infants is, okay, yes, a defect here. Well, really not a defect. This means, yes, okay, just the bones have not fully developed and fused together. So this empty area here, that's what actually is, okay, they were called the anterior fontanelle. Okay. Most people may know, yes, okay, the fontanelle as, okay, what they call, yes, okay, the soft spots. Why do we call this one here the anterior fontanelle? Because it's the soft spot on the front side. Did you guys get that?
Yes.
Yes.
Right, okay. Whereas we look here, yes, okay, that's going to be this one here. Which they just says, okay, we'll call the posterior fontanelle. And again, yes, okay, why in the blue is it that we call it a fontanelle? Mainly because that's okay, that's a soft spot. But this one is going to be the posterior. Why? Because it's at the back side of the skull. Okay, now we mainly can say that, okay, at the anterior fontanelle, where is that going to be found? That's going to be, okay, along the, that's okay, the coronal suture. Whereas if you just look at, okay, as where your posterior fontanelle is going to be, yes, okay, that's going to be along the lumboidal suture. Is that clear?
Yep.
Right, okay. Now, guys, so why did I want to, yes, okay, mention the fontanelles here? Now, usually that's okay, the posterior fontanelle, first of all, it's okay, it's smaller in size. Clear? Okay. It's also going to be the fontanelle that most likely is okay, will close first. So around, yes, okay, the age of 6 months, the posterior fontanelle will be close together. Did that make sense? Whereas the anterior fontanelle may be, yes, okay, open or still be there, yes, okay, at least 2 years, okay, anything between, yes, okay, 12 to 18 months. That's where you will have, yes, okay, the anterior fontanelle. But you can say, yes, okay, the older and older and older the child grows, it's okay, it's going to become smaller and smaller and smaller. Okay. Now, God forbid, but just by me saying it's okay, God forbid, doesn't mean that it won't happen. But you may, yes, okay, get young children that needs to be scanned in their head. Okay. Mainly to yes, okay, check on things such as okay, yes, hydrocephalus and so on. So there you actually is okay, will use the fontanelles as a port to scan through. Okay. Because okay, what is it you have is okay, there's an area where there's no bone. So that's what you actually is okay, will be using as a window to yes, okay, place your transducer. Okay. Because the sound wave is not going to be able to yes, okay, travel through bones. So you can place it here on the parietal bone or any bone. That's okay. What's going to happen? Well, okay, yes, there's not going to be much sound wave that will be able to yes, okay, penetrate the bone. So wherever you scan, yes, okay, you might yes, okay, find or scan through a, you can say okay, boneless area, or yes, okay, through a hole, yes, okay, where there's going to be yes, okay, no bones in the in the way of the sound waves. Did that make sense? So up to yes, okay, a certain age, yes, okay, you may be able to yes, okay, use the anterior fontanelle as a port to scan and check, okay, yes, is there any yes, okay, build up of okay, as you can say, it's okay, fluid inside the skull that actually is okay, may put pressure up against the brain or things like that. Did that make any sense? Okay, so where do you usually okay, find the anterior fontanelle? Yes, okay, mainly that's around along the suture line of the coronal suture. Where do you find the posterior fontanelle? Yes, okay, along the suture line of your lambdoidal suture. Okay, did you guys get that? Okay, so that is going to be okay, the anterior fontanelle versus the posterior fontanelle. Did any of you, or do any of you have any questions?
No.
Okay, good. That sounds good.
I see, I'm sorry, I see the squamous suture in the book. Is that
No, don't worry about that one.
okay?
Because okay, for you guys, it's okay. It's not going to be of much relevance. Second of all, it's okay. It's relative. It's okay. You can say it's okay. Difficult to mark on the surface anatomy. Okay. But mainly, it's okay. It just runs between it's okay your parietal and the temporal bone. So again, yes, okay, what were your bones? Frontal bone, parietal bones, sphenoidal bones, or wings of the sphenoidal bone, temporal bone, and the occipital bone.
And ethmoid.
Well, okay, that's well, okay. Be more. It's okay. When I was doing it, it's okay. They talked about it as a bone of the orbit. But anyways, again, yes, okay. The small bones, and yes, okay. That's okay. Ethmoid is a small bone. So okay. Now, guys, something that is not mentioned in your book, but I still find it funny to talk about. And not just funny, I found it as okay. Important. Now, unless somebody's skull is okay as well, even in that sense, even in that case, is okay if they have okay as a skull that's flat on the top. But what would you call the tallest point of your skull? Tallest point, not by you pacing or say your bun up here. Your bun up here. Well, let's put it this way. If we were cone heads, what would you call this point of the skull?
The apex.
No.
No?
Okay, I can tell you, okay, that you're right because, okay, as it ends with X. It's the vertex. Is that clear? Who's unmuted again? You can say it's okay, the tallest or highest point of the skull. It's called the vertex. Did you guys get that?
Yep.
Any questions?
No.
So far it's okay. What have we talked about? We can say it's okay. Bones of the cranium, frontal bone, parietal bones, occipital bone, temporal bone, and the sphenoidal bone. Coronal suture, sagittal suture, and lombardal suture. The soft parts of fontanelles, as they call them, anterior fontanelle, posterior fontanelle. And okay, as the tallest point of the skull is known as the vertex. Okay, guys. Now just one little topic and then we can go on a short break. And okay, guys, let's just take this fellow off here. Everybody got what the vertex is?
Yeah.
Good. Now the next thing that I mean is okay, just briefly talk about is what we actually is okay call the paranasal sinuses. Okay, Now, some people may, it's okay, just refer to them as the sinuses. But the actual term is paranasal sinus. Because what was it that the word sinus meant?
Passage? Like a tunnel?
Okay. So it could be a fistula. So it could be as okay, any body passage. Ended up in a dead end, right?
Yes.
Okay, that's mainly it's okay why we call them sinuses. Okay. Because okay, these are dead end cavities or spots or areas, yes, okay. Which mainly is okay are going to be as okay is okay parallel. The para here is mean is okay because of being parallel to the nose. Okay. So mainly because the location is okay, they are parallel to the nose. And mainly it's okay because those passages ends up in dead ends. That's why they call them sinuses. So the actual name is paranasal sinuses, but people just says okay, short it and made it or call them sinuses. Now, guys, these sinuses here mainly is okay are going to is okay. Are going to is okay named in accordance to the bones where they are found. So the first one we can talk about is going to be as okay the frontal sinuses. The next one is going to be as okay what we call as okay the maxillary sinus. The third one is going to be as okay the ethmoidal sinus. And the last one is going to be as okay the sphenoidal sinuses. But they're mainly as okay, as I say, as okay, named in accordance to as okay, the bone where they are found. So this the frontal sinus is in the frontal bones. Maxillary sinus in the bone that we call as okay, the maxilla. And the maxilla is going to be as okay, the main bone of the face, so we can say it's okay. Upper jaw. Then we have okay, the ethmoidal sinus. We just talked about is okay. Bone of yes, okay. Medial side of the orbit. On ethmoidal bone. And then we have okay the sphenoidal sinus, which is going to be as okay in the sphenoidal bone. If you look at the sphenoidal bone, that's okay where the sinus will be, as okay, that's going to be as okay the posterior of the orbit. Did that make sense? So guys, where do we find the frontal sinuses. Right here. Okay. Slide about, yes, okay, where you'll find your eyebrows. Okay. So why do we call them sinuses? I mean, yes, okay, because it's going to be, yes, okay, a hollow space within the frontal bone. Okay. But yes, okay, from that, there's going to be in a dead end. But yes, okay, from that is actually going to be a duct that goes to the nose. So your sinuses pretty much, okay, as drain into the nose. Clear? Okay. Now, just in a little bit, we can say, like, after we sorry, yes, okay, from our break, yes, okay, we'll talk about the facial bones. Right, okay. But here, okay, pretty much, okay, as the major bone of your upper jaw is going to be the maxilla. And right here, that's where you find the maxillary sinus. Now, the ethmoidal sinuses are going to, yes, okay, be right by the ethmoidal bone. And your sphenoidal sinuses, guys, if I stab in here and stab right here, where these two fingers will meet inside the skull, that'll be, yes, okay, where you'll find the sphenoidal sinus. Is that clear? So frontal sinuses, maxillary sinuses, ethmoidal sinuses, and sphenoidal sinuses. Did you guys get that?
Yep.
Okay, so as long as, okay, as you know their names, you should be good. Okay, as long as, okay, as you know the rough location of the frontal and, sorry, the maxilla, you should be good. Did you guys get that? What are the four sinuses, or what are the four paranasal sinuses to be more politically correct? Frontal sinus, maxillary sinus, ethmoidal sinus, and sphenoidal sinus. Did you guys get that?
Yes.
And oh yes, okay. If we look at our, oh, let's look at my slide. That's better. If anybody else, okay. So can you guys see this?
Yeah.
Okay, so these are just, okay, just the four names of your sinuses. The frontal sinus, which you have here. You can say the maxillary sinus, which are here. Then we can say, okay, we have the sphenoidal sinuses. Okay. And the ethmoidal sinuses right next to us, okay, the ethmoidal bones. Yes, okay. So frontal, maxillary, sphenoidal, and it's okay, here will be the ethmoidal sinus. Did you guys get that?
Yeah.
Yes.
Okay, guys. Now just take a short break and we'll be back at 10:30 sharply. Yeah. let's briefly talk a bit about this. Okay, some of the facial bones. And okay, yes, take it from there. Guys. Any questions yet? Okay. Okay, let's do this. Okay, guys. Now we can say it's okay, the facial bones. What can you guys see? Let's see. Okay. So facial bones. Now that's going to be as okay one. Mandible, or what we can call as okay the lower jaw. Okay. We're going to have as okay two upper jaw bones are also known as the maxilla. Let's just make this a little bit bigger. Okay. We will have, okay, as what we can call as, okay, the zygomatic bones. Or as, okay, what you also can call it's okay, the cheekbones. Okay. This fellow here. Oh, that's okay. I mean, it's okay, just cover it up. That's going to be, okay, what we will call the boomer. Then we have, okay, as the inferior turbinate bones. Then, okay, as if you go to the bottom of the, what do you want to call that fellow? Skull. It's okay, we will have, okay, what we call the palatine bone. This is me, it's okay, going to make it, okay, you can say the roof of your mouth. Okay. And then last but not the least is, okay, the two nasal bones. So that's mainly going to be, okay, the bones of your facial skeleton. So you can say, okay, the nasal bones, the vomer, the inferior turbinate bones, the maxilla, the mandible or the maxillary bones, the mandible, and the zygomatic bones. Did you guys get that?
Can you repeat that? Because I think I'm missing one.
Your nasal bone. Look here, dear. Your nasal bone. Clear? The zygomatic bone. The maxillary bone. Or bones. The mandibles. Or the mandible. Clear? Okay. Now, when we have deeper is going to be as okay, what we call as okay, then inferior turbinate. That's going to be on the lateral wall of your nose. Okay, it's going to be what they call the inferior turbinate. Okay. Then we have as okay, what we'll call the palatine bone, which means as okay, makes the roof of your oral cavity. Clear? Okay. But the one that are going to be important is, well, okay, as we can say, is okay, the zygomatic bones, the maxillary bone, and the mandible. Okay. So nasal bones, vomer in the middle, zygomatic bone, or the cheekbones, as you may call them, the maxilla, bone of, okay, as the upper jaw, and the mandible. Clear? Okay. And what we said was that, okay, as the mandible joins with, okay, as the temporal bone to make the only, yes, okay, real, yes, okay, mobile joint in the facial or craniofacial skeleton. Did you guys get these bones here? Any questions? Oh, yes, okay, if we look here. That's why, okay, I like my slides better. So that's okay, we have a total of, okay, as 14 bones in the, in the facial skeleton. Oh, sorry, I forgot to mention the lacrimal bones. Okay, sorry. Lacrimal bone right here. Now, if you at any point, it's okay, you say it's okay, wear glasses. You know, it's like, I don't need reading glasses or so. If you wear sunglasses, those plastic pieces of your glasses, actually, that's okay, the rest here, that's going to rest on, that's okay, what we call the lacrimal bone. So that's okay, the lacrimal bone, nasal bones, zygomatic bones, maxilla, mandible, vomer, and palatine bone. Okay. Now, why do they call them this one here? Okay, the lacrimal bones. Now, the lacrimal actually is okay, is pertaining to tears. So lacrimum is the technical word for tears. Now, that's okay. What we actually have here is what we call as okay, the lacrimal gland. Okay, so that's okay. Mainly it's okay, the bone right next to us, okay, where we have the lacrimal gland or the tear gland. Is that clear? Okay. So lacrimal gland, lacrimal bone. Slightly posterior to that is going to be the ethmoidal bone. This is the nasal bone. Deeper inside, not this. This is cartilage. This is nasal cartilage. But actually, it's okay. Deeper in the facial skeleton is going to be what they call the vomer. Clear? Your zygomatic bone, maxilla, mandible, inferior turbinate, and the palatine bone. Okay. So what they mainly is call the whole roof of your mouth. The roof of your mouth is going to be called the palate. Clear? Okay. Now later on, I think it's when we talk to digestive system / respiratory system, we may divide the palate into two parts. The hard palate, which is going to be the anterior part of your palate, mainly because that's where you have the bone. And the posterior palate, which is going to be the soft part of your palate. Mainly because in that part is you don't have bone. Okay. So palatine, that's from pertaining to the palate. What's going to be the palate? The roof of your what do you call it? Mouth or a cavity, right? Okay. Did you guys get that? Okay.
Yes.
And so of course, that's your bones of the facial skeleton are also going to be we can say joined together by sutures. But just understand that that these here are again immobile joints, which have no movement. Clear? So these are going to be what we for now refer to as being immobile joints. Okay, with no movement. Actual only joint that is mobile in this skeleton here is the TMJ or the temporomandibular joint. Okay, so that's your mandible actually is forms a joint with the temporal bone. Okay, right anterior to is what they call is the external auditory meatus. Meatus is just another word for opening or hole. And that's true as where your ears will open. Now, guys, in each middle ear, is we got 3 bones. And we can for sure to say is these are the smallest bone in the body, in the middle ear. Okay, as they're going to be 3 bones in each ear. Okay, guys. Now, so the only thing that you will need to remember is the names of these 3 bones here. So we can say, the bones of the middle ear. Now that's going to be 3 in each ear. Okay. So they are going to be called the incus, INCUS. the malleus, M-A-L-L-E-U-S. And the last one is just going to be the stapes, S-T-A-P-E-S. Is that clear? For each year is going to have an incus, malleus, and stapes. The other year is going to have an incus, malleus, and stapes. But these were the names of the 3 bones in the middle ear. Okay, and these actually, that's okay, areas, okay, because that's okay, the vibrations from the eardrum to the inner ear. There's actually going to be, okay, the movement of your eardrum that puts these bones, that's okay, here into motion, which is going to create waves in your inner ear that will produce waves in a fluid called the endolymph, which called, okay, as movement of cilia in the lining of your inner ear that are picked up by nerve signals that then gets to your hearing centers, where you're able to hear the sounds, hear the sound of your teacher speaking, maybe as, okay, a motorbike or car or truck or so as, okay, driving on the street, singing bird, music playing in the background, whatever. Your dog barking, your cat meowing. Did that make sense? Okay. So that's okay. The 3 bones of your middle ear, incus, stapes, and malleus. And then the unique bone in the body, which did not make any joints with any other bone, the hyoid bone. And that's right here. Now don't press on that one. Okay, you may feel it as, okay, if you go right here, but don't press on it because it's made as, okay, just shape something like this. This is the main shape. That's the shape of it. But it's okay, if you press on it, what may happen? It can break. Okay. Any question, guys? Does anybody have any questions?
Oh,
No.
Nope.
No.
Goody, moody, moody. You just see. Okay. Okay, now before I show you guys this, there's the little thing I want to show you. I'll show you. Okay, guys. Okay, guys. You guys can see the pictures from the book.
Yeah.
Okay, what is something looking like that? Because it's okay right now, it's okay. We can say it's okay. We are looking inside the floor of the cranial cavity. I mean, that's okay, just a cup. That's okay, 2 small things that I want to show you. Now, if you see this one here, this is mainly okay what they call okay the cribriform plate of the ethmoidal bone. And what you actually will see here is going to be okay small holes or openings. Now, guys, the reason that you may be smelling that okay as somebody is cooking something or any kind of smell, that's due to these holes in the cribriform plate of the ethmoidal bone. Because actually it's okay through these openings here that okay as the sensation picked up by is okay what we call the olfactory nerve, the nerve of smell, or the nerve that senses smell. Actually it's okay hits the brain. Is that clear?
Yeah.
Good. Now, guys, another thing that you also may see is this area here. Now, that's actually okay what they call cellular tertiaria. Okay. Cellular tertiaria. Nocella, guys, that means, oh, that's just a fancy word for saddle. Okay. And the word tertiaria does come from Turkish. So what I guess was, okay, they call it as, okay, the Turkish saddle. Mainly because, okay, I guess back then in Turkey, they were having, yes, okay, camels with 2 humps. Usually it's okay, the camels that we see nowadays only have 1 hump. But what they had back then was, okay, as camels with 2 humps. And what they mean is, okay, will fit in between those 2 humps was going to be a saddle. So they call it after that. But okay, yes, what is going to be in this Turkish saddle or is okay, the cellular tertiaria, guys, this is going to be as okay where we will have the pituitary gland. Okay, so it's going to be as okay in the cellular tertiaria in the sphenoidal bone where the pituitary gland is going to be placed. Actually, it's okay if you look at it from the side, we can say that okay, yes, this is the it's okay, sphenoidal bone. This is the sphenoidal bone, and okay, yes, what we actually have is that's how you go. That's if you look at it from the side. If you cut the skull like this and look at the, so that's okay. It looks like it's okay. This area between it's okay. The 2 humps. That's like okay, that's where they place the saddle. Have you guys ever seen it's okay the picture of a camel with 2 humps? Okay, so maybe no. Okay, then just look it up. So, okay, guys. Now, do you guys have your popcorn ready? I see somebody have their coffee or chocolate milk or
Coffee.
coffee. Okay, good. It's probably too late. Yes, okay. Throw some popcorn in the microwave now. So yes, okay. Just enjoy. Yes, okay. This little movie here is okay with that's okay, you can say it's okay. So can you guys see this fellow here? Okay, you better.
Yep.
Good. Okay, it may get a little graphic, but okay.
The human skull is made up of 8 cranial bones that surround and protect the brain, and 14 facial bones that form the underlying structure of the face and support for the teeth. With the exception of the mandible, the bones of the skull articulate with each other through joints known as sutures. Throughout the skull, holes known as foramina serve as passageways for blood vessels and nerves. Bones on the surface of the skull encase the brain, protect sensory organs, and serve as attachment sites for the muscles of the head and neck. These bones include the occipital bone, parietal bones, temporal bones, and the frontal bone, as well as the nasal bones, the zygomatic bones, the maxilla, and the mandible. Other bones become more visible only when looking inside the skull. The sphenoid bone makes up the anterior base of the cranium. It is a butterfly-shaped bone with a central body and 2 pair of laterally projecting wings. These wings form portions of the orbit. The body of the sphenoid features a depression known as the sella turcica, which houses the pituitary gland. Located between the orbits, the ethmoid bone makes up a portion of the cranial floor and also the roof of the nasal cavity. An inferior projection, the perpendicular plate of the ethmoid bone, forms part of the nasal septum. The crista galli projects superiorly from the ethmoid bone and serves as the attachment point for the falx cerebri, a dural fold. Extending laterally from the crista galli is the cribriform plate, a perforated area through which the olfactory nerves pass. The 2 L-shaped palatine bones form the posterior third of the hard palate, part of the nasal cavity, and a portion of the orbit. The small, thin lacrimal bones make up the anterior portion of the medial wall of each orbit. A groove known as the lacrimal groove helps to form the nasolacrimal canal, which contains a duct that allows tears to travel to the nasal cavity. The vomer is an elongated, plow-shaped bone that forms the inferior and posterior part of the nasal septum. The internal and external skull bones articulate precisely, forming an intricate structure perfectly suited to its functions.
Did you guys get that? Okay, guys, now I guess, okay, as a point that may not be mentioned in the book, but let's just look at it. Okay. And we can see it's okay now that pretty much, okay, yes. We can say it's okay, applies to the cranial bones. Oopsie. So we can say, okay, the cranial bones are, we can say, okay, let's put it, so I guess, structurally going to be what we call diploid. Now, what would that mean? What do we mean by okay, diploid? That's mainly going to be that okay, as we will have, we can say that's okay, an outer layer and an inner layer, which is going to be compact bone. Is that clear?
Yeah.
And what we actually is okay have in between is okay these two layers of compact bone. Here the remaining is okay. We'll see that okay as the cancellous bone. Or we can say it's okay the spongy bone. Or cancellous bone is, or we can do it this way and say it's okay that the spongy bone is sandwiched in between two layers of compact bone. So this kind of arrangement here is okay, that is what we call a diploid. Did you guys get that?
Yeah.
Okay. Now outside here, it says, okay, this is outer side. Okay, that's where we have the periosteum. Whereas, okay, as we can say, it's okay, on the inner side is going to be endosteum. Did you guys get that?
Yep.
Yep. Or if you want to look at it in a different way, we can say it's okay, something like this. Yes, okay, it's going to be as okay referred to as the diploid, which means okay, is going to be as okay the cancellous bone or spongy bone in the middle of two layers of compact bone. So that's okay. What we have here, this is a real, it's okay. You can say it's okay. Cross section of the skull bone, compact bone on the outer side, compact bone on the inner side. In between them is going to be as okay, or sandwiched in between these two layers of compact bone is going to be the spongy bone, which will be the diploid. Or likewise here, compact bone, and in between is going to be as okay the spongy bone. Did that make any sense at all?
Yeah.
Good. Any questions, guys? So, frontal, parietal, occipital, temporal, sphenoidal, ethmoidal, nasal, zygomatic, maxillary, mandible. That's right. Right. coronal suture, sagittal suture, lomboidal suture, anterior fontanelle, posterior fontanelle, and
Vertex.
vertex. Oh, that's okay. If we were cone heads, have you guys seen that movie?
Yep.
Okay, you're better than me. I only seen the poster. Okay, but as Giga says, okay, if you were cone heads, that's okay. That top of that cone, that was going to be as okay what we could call as okay the vertex. But practically as okay the tallest or highest point on the skull. Clear? Good. Okay, our sinuses, frontal, maxillary, ethmoidal, sphenoidal. Right, okay. Middle ear, incus, stapes, and malleus. Right, okay. Unique bone in the body that doesn't articulate with other bones, hyoid bone. Any questions? Now, guys, the next part of our axial skeleton that we may talk about is going to be the what the hell we call it? Vertebral column. Vertebral column or spinal column, right? Okay. Okay, and what is that going to be? Or you can say it's okay, the backbone. Okay, so we may call it okay, the spinal column because it's made up of the spine or makes up the spine. We may call it the vertebral column, that's okay, because it is made up of vertebrae. Okay, so we can, that's okay, let's go with, okay, as the vertebral column. And why do we call it the vertebral column? Because that's okay, it is made up of vertebrae. Now, yes, okay, just to make it easier, we can say, okay, as far as, okay, as for vertebral column or vertebrae are concerned, okay, shit, sorry. We can say, okay, there it's okay, we can, first of all, it's okay, just classify them into two major groups where we say, it's okay, unfused, which makes them mobile. And okay, yes, the other group which is going to be fused, which make them immobile. Did you guys get that? Did you guys get that?
Yes.
Yep.
Good. Now, as far as okay, as our unfused or immobile or mobile, sorry, vertebra, we can divide those into three major regions, which is going to be as okay, the cervical vertebrae. We have the thoracic vertebrae, and the last is going to be as okay, the lumbar vertebrae. Did you guys get that?
Yep.
Now, guys, as far as, okay, we can do it this way and say it's okay, the cervical vertebrae. There's going to be, it's okay, they're going to be, it's okay, a total of 7. Then we may, it's okay, may just label them as okay from C1 to C7. Is that clear?
Yeah.
Good. Now, guys, C1, or we can say, okay, the first cervical vertebra may also be known as the atlas. Is that clear?
Yep.
Whereas we can say it's okay that the second cervical vertebra, or what we also as okay may refer to as C2. It's okay, he or she, sorry, may also be known as the axis. Is that clear?
Yep.
Good. Now, guys, if I say the word atlas, generally not talking of vertebra, what would be the first thing that comes to your mind?
Like a map or a globe.
So they mainly as okay call this vertebra here was okay the topmost vertebra of your neck, the atlas, because it was mainly as okay going to be as okay the vertebra which was going to as okay hold on to your skull or cranium. So the mainly as okay named it after the Greek god that is believed to as okay carry the world on his shoulders. That's a hell of a shoulder he got. But even they as okay believed, okay, knew back then that okay, as the world is round and not flat. Now, is there any of you who believe that the world is flat? Then that's okay. Nothing wrong in that. Okay. You may say, okay, then what about the people who live on the down end here? So, okay, are they upside down? Okay. But it's okay. It was a concept that, okay, once you travel the 7 ocean, you reach the world's end. And if the world end is okay, it was a flat plate, you will drop out into, yes, okay, what had been, okay, the concept of outer space or something like that. Well, that's okay, a hell of a waterfall. Because you reach to the end of the world. Okay, peace be with that. So they call it Atlas in accordance to, yes, okay, the god in Greek mythology, which holds on to the world or globe. And then they made us, okay, just copy and paste it. The word Atlas. Now onto is okay, a book that holds, or is okay, may display, or is okay, give us a, it's okay, it's okay. Ability is okay, visualize the map of the world. This is where the countries are and so and so. Have any of you ever played those games that says, okay, yes, if you're able to, yes, okay, locate all the, or name all these 10 countries, you have an IQ of so and so? So I guess geography hasn't been your strong side. Maybe I should do that. Okay. But yes, okay, that's pretty much okay. That's why they call it an atlas as well. Okay, so yes, okay, since these two, yes, okay, vertebrae, yes, okay, go under specific names, well, okay, what did that tell you? Much to know. So first cervical vertebra known as the atlas, second cervical vertebra known as the axis. Then you got 3, 4, 3, 3, 3, 3, 4, 3, 5, 3, 6, 3, 7. Okay. Did that make sense?
Yeah.
Okay, guys. Now you were thoracic vertebrae. Now we all know that that's going to be okay a total of 12 vertebrae. And okay, guys, that's okay. That's just going to go from yes, okay, G1 to G12. Yeah. No Humpty Dumpty names or whatsoever. The last group of okay, what we can say is okay, the unfused is okay. Vertebrae that are going to just okay be mobile, mainly because okay, we actually will be able to just okay move yes, okay, these joints, just okay, move along these joints here. Is going to be as okay the lumbar vertebrae, and that's going to be as okay a total of 5 vertebrae. Right, okay. And they're just going to be called as okay L1, 2, L5. Okay. Now, guys, and especially as okay, and that's okay, when we just okay, going to just okay talk about blood vessels. That's okay, especially as okay the thoracic vertebrae, we can say okay thoracic vertebrae T4 is going to be important. Even yes, okay, thoracic vertebrae is okay G11 will get important, and G12. Then it's going to be as okay, such as L1, L2, L3, and L4 is also going to be important. So when I say it's okay, this and this happens at the level of L4, this and this happen at the level of G4, this happens at a level G12, so on. So I will expect that you by that time is okay, know that G12 means the 12th thoracic vertebra. G4 means okay, the 4th thoracic vertebra. And I say L2, yes, okay, second lumbar vertebrae. So and so. Did you guys get that?
Yeah.
Good. Now, our immobile vertebrae. Means okay, they were immobile, means okay, because they were fused together. Right, okay. And the two sets of vertebrae that we had was the sacral vertebrae. Okay, and okay, yes, practically, yes, okay, we had a total of 5 sacral vertebrae, which means, yes, okay, it goes from S1 to S5. Did that make sense?
Yeah.
Okay. And as we saw it earlier, we said, okay, that the sacral vertebra, well, okay, always, okay, the initially is okay, were 5 several vertebrae, but they fused together to become a plate, which we actually just call as, okay, the sacrum. And what you guys saw on the that's okay skeleton earlier today, that okay, yes, your pelvic bones are as going to be as okay, which will form as okay the pelvic girdle are going to be as okay attached on either side onto the sacrum. But the sacrum, which is made of the 5 sacral vertebrae, is a part of your axial skeleton because it's a part of your vertebral column or spine. Did you guys get that? Whereas the last one was what we can call as okay the coccyx. But the mean is okay, so that's going to be as okay, anything be as okay, 3 to 5 small vertebrae. Okay, but they are not going to be called CXY or CO or C or something 3 or 1, 2, 3 so no. Okay. So these were yes, okay, you can say it's okay, your division of your what was it that we call it? Your vertebral column. Okay. Now, when we say that, okay, as vertebrae, as okay, we're unfused or we're not fused together. That may mean that, okay, we could say that we have a vertebra above, we have a vertebra below. Okay, and actually, that's okay, in between, yes, okay, the bodies of these vertebrae here was going to be a body of cartilage that we just call the intervertebral disc. Okay, which actually is okay, was a piece of cartilage in between is okay, the 2 bones. In this case, that's okay, between the 2 vertebrae. Okay, but when I say mobile, that's okay, guys, as you will see later on. Probably not today, we will probably it's okay, reach that point tomorrow. That okay, even though that's okay, we say mobile, but that's okay, this mobility here is limited. Okay, so it's not going to be as okay, freely mobile. It's going to be as okay, a limited mobility. Unless somebody is that person is okay, this and this and this country got talent. Okay, where you may see people that actually is okay are going to sort of flex around like okay, like they got no bones. Okay. Any questions? Okay. So that's okay. Which are is okay. We can say the mobile, which are the immobile part of the vertebral column. Okay. What are they called? Cervical, thoracic, lumbar, sacral, and coccygeal. How many vertebrae do we have in each group? Cervical is 7, thoracic is 12, lumbar is 5, sacral is 5, and coccygeal, 3 to 5. So we're not going to just, okay, fight much on about those. Is that clear, guys?
Yep.
Any questions? Nope. So everybody's clear so far? Okay. So the only SOK vertebra that go with some fancy names is the first cervical vertebra called atlas, second cervical vertebra called the axis. Now, guys, we go to the ribs. Now, guys, ribs is mainly SOK, just we can say SOK. Oh. An English word where the actual SOK technical term for ribs is going to be costa for one rib, costae for multiple ribs. Is that clear?
Yes.
Good. Okay. Now, guys, what is going to be unique about the ribs? Especially enough. Actually, that these are going to be paired bones. Which you may say when it's paired, it's going to be right and left. Did that make sense?
Yeah.
Now we actually have a total of 24 ribs. But these 24 ribs here are going to be divided into 12 pairs. It mainly means, guys, that yes, if you look at it, you got 12 ribs on the right side, and you got 12 ribs on the left side. Clear? That gives you a total of 24 ribs or 12 pairs. Did that make sense?
Yes.
Good. Okay, guys, now comes the funny part. Well, because it's we can say, well, it's the distribution of the ribs. Now, as far as the distribution of the ribs is concerned, it's we can have two major types or two major groups. That's going to be what we will call the true ribs. Okay. Now these true ribs here may also be known as the vertebral, from the vertebral or spine, sternal, pertaining to to the sternum or the chest bone. Ribs. So the true ribs are going to be as okay, also known as the vertebrosternal ribs. Is that clear?
Yep.
Okay. And what is that going to be? That's going to be as okay from rib 1 to 7th pair of ribs. So we can actually say, okay, the first 7 pairs of ribs are going to be as okay, the true ribs, or what we call the vertebral sternal ribs, because they're going to come directly from the vertebral column and directly as okay attach onto the sternum or your chest bone. Is that clear?
Yeah.
Yes. Now, guys, the second set of, okay, we can look at the other kind of ribs that we may have are going to be what we call is okay, the false ribs. Is that clear?
Yep.
Now, guys, the false, yes, mate, okay, good. So the false ribs is mean as okay, is going to be as okay, be from the 8th to the 12th pair. Ribs are going to be as okay, your false ribs. Okay. Did that make sense? So the first 7 pairs of ribs are true ribs. The 5 last pairs are false ribs. Pish?
Capiche.
Good. Now, the false ribs, my guys, can be further, yes, okay, divided into 2 subclasses. And what we actually say is okay, that okay, as the 8th to the 10th rib. These ribs can also be called the vertebral. From the vertebral column, chondral ribs. Mainly because that's okay, now that's okay, posterior is okay, they attach, yes, okay, their respective vertebra. Or that's okay, respective thoracic vertebra. But anterior is okay, or in the front, they're not going to, as okay, directly as okay, articulate with the sternum. But actually, it's okay, well, it's okay, it's okay, meet together, it's okay with a body of cartilage to the ribs above. And in that way, it's okay, we get this, and it's okay, attached onto the sternum. Did that make sense? And that's why we, as okay, call those as okay, lower, as okay, upper right regions. upper right and left regions of the abdominal cavity, the hypochondrial regions. That makes sense?
Yeah.
Good. Whereas, okay, we then can say as, okay, the last two pairs of foreribs, which is going to be as, okay, the 11th and 12th pair. These are actually as, okay, going to be called the floating ribs. Okay, yeah, we can mean it as, okay, they were only as, okay, articulate to the vertebra in the back. But on the anterior side, as okay, they're not going to be as okay articulating with any other bones. And that's okay why they're going to be as okay, we can say floating.
So
Did you
11 and 12 are not connected to the sternum, right?
No, no.
Okay.
All right. As a matter of fact, yes, okay, if you look at the size of them, because most of your regular ribs, that's okay, will be as okay, curve, like okay, this is okay, a bow or something. That's okay, the 12, 11, and 12 rib as me is okay, going to be physically smaller. Okay, because okay, they're only going to be as okay lying at the back side or lower back. But they're not long enough to as okay attach to as okay any of the ribs above through cartilage or anything. So me is okay because they're only attached on as okay the vertebral sides or ends. They're going to as okay, not be floating by us okay. Okay, that's okay. Okay. Did that make sense? Okay. So you can do it this way and say okay, let's see, we just see. And if this here is okay, for instance, okay, was your vertebral column of your thoracic spine, a thoracic vertebrae. Because it's okay, the first set of 7 pairs at the back where it's okay attached to the vertebral column. I mean, it's okay, comes anteriorly. Yeah, it's okay, they were attached onto the sternum. Whereas, okay, as the next pair, 8 to 10, is okay, posterior is okay attached to the spine, anterior is okay will be attached onto cartilage. And through that, yes, okay, cartilage or yes, okay, attached onto the lower surface of the seminal vertebrae, and that's okay, attached to your sternum. Where okay, as the last 2 vertebrae. It just be like this. And guys, now I don't know how much you believe in that, but they said that Eve was made up of a rib from Adam. He was lonely, had nothing better to do. So he asked God for a companion, and God told him, okay, give me a rib of yours. Now he made Adam out of nothing, right? Okay. Do you guys what he made an Adam out of? Do you guys know what the word Adam means?
You're talking about the basic unit of life,
Adam.
a molecule.
No, not atom.
Talking about the name
Adam.
Adam.
Yeah.
I don't know what it means.
Now they say that he has a brownish reddish complexion. So that's what it means. Okay, that's fine. But it's okay. Couldn't God have told him, "As okay, you know what, just give me as okay one of your phalanges or any other bone." Why did God ask him to choose as okay, use a rib or lend a rib? Adam, as a matter of fact, was made out of soil. So, well, okay, if God had made Adam out of soil, then okay, I couldn't Adam just make something like me, just like you made me. What's the whole purpose of okay us asking for a rib? God could ask for any other bone, right? So what's the lesson for Adam here? Or you can say for the man. No clue? Okay, guys, what is close to your ribs?
Your heart and lungs.
Heart. Let's just stick to the heart. So what did that tell you? Or tell us men? Love your female companion, right? Did that make sense? Good. What's the shape of a rib? Have any of you ever seen a rib? I just told you. It's curved. So don't try to straighten it out because what's going to happen? What's going to happen, guys?
It'll snap.
Or break, right? Have any of you ever had a fractured rib? No, okay, don't wish for that. Okay. Okay. So, well, okay, don't try to change her. Because, okay, they are relatively delicate and they may break or break down. And then you will feel that pain too. So that's, you can say it's okay, if you look at the spiritual side of, okay, that's why God asked for a rib and not any other bone. That's the reason. So now you girls can claim that, okay, yes, we deserve to be loved. Don't try to change the way we are because it's okay, we may break. And when you break, what's going to happen? Well, yes, okay, your lacrimal glands are filled up to the brim, ready to shed at any time. Cheers. Have any of you ever cried during a test? If it's one-to-one with the examiner, no, you wouldn't. That's too childish or chickish to be doing. But that's okay. We actually seen girls that's okay in med school who will walk out of their examination room crying. We say, shit, it looks like she failed. And when the result came, no, she passed. And we walked in, okay, couldn't answer many questions, and okay, came out not a single tear. Okay, we failed. So, but is it the cheers? No, I guess not. But anyways, so that's okay. So these were just okay. You can say it's okay, your ribs. Clear? Okay, so how many pairs do we have? 12 pairs, but that's going to be it's okay, a total of 24 ribs. Clear? Don't say that we have 12 ribs. That would be saying, yes, okay, well, okay, if I buy a pair of shoe, I only get one shoe in the box. If I buy, it's okay, a pair of socks, I only get one sock in a pair. Or mittens or gloves. Those are things that comes in pairs, right? Okay. The packet may hold, yes, okay, 12 socks, but you get 6 pairs. Unless you choose not to wear, it's okay, a sock on one foot. That's your choice. Right, okay. Okay. But that's okay, they come in pairs. Okay. You go to the shoe store and buy a pair of shoes, that's okay, you expect a shoe for the one for the right foot, one for the left foot. If you come home and realize there's only one shoe in that shoe box, what would you do? Yes, guys, what would you do if you find only one shoe in your shoebox?
Go back and get the other one.
I'll go back and get the other one. Okay, good. Now I have another question. While you find a pair of shoes, that's okay. You have 2 shoes in the box. Now one is for the right foot, one is for the left foot. But the one for the right foot is black as a black shoe. Same design, same size, same make, same everything. But the one for the other foot is a brown shoe. What will you do? You go back. Okay, Dr. Tracy. And what do you expect to happen?
They need to fix it.
How?
No.
Tell them that you want the other shoe. Of the
Other
color
shoe
that
of
you
which
want.
color?
Whatever one you want.
Okay. Do you think they'll be able to give it to you, Dr. Moritz?
I would hope so, unless
You
somebody
hope
else
so.
took whoever else took the other brown and the other black, and it's not in the
Okay,
store.
yes. I would like to meet that person who is walking around in my pair as well like that. Because that's okay, that's what I got once. So I have a nice pair of shoes that I can't wear. Well, I can, but okay, yes. You guys may say, well, okay, Mike, Halloween is over. Get over it now. Right, okay. Well, have you heard of, okay, yes. This is not what we call mix and matching. Right, okay. This is not mix and matching. This is mainly as okay, where you mix to unmatch. But yes, okay, I have a pair of shoes and I went back and say, okay, I expect that you have a similar pair in the storage. And I would really like to get my black pair of shoes. Well, okay, I didn't get my other black shoe. I just got a shrug on the shoulders by the guy. So I said, well, okay, I hope somebody comes back with another pair like this and throw those shoes at you. But anyways, so yes, okay, these were, okay, 12 pair of ribs, which makes up a total of 24 ribs. The first 7 pairs were true. The last 5 pairs were false. Clear? Did that make sense? Okay. The true ribs were also called vertebral sternal lips, mainly yes, okay, because they start from the vertebral column and attaches onto the sternum. Clear? The remaining yes, okay, 5 pairs was 8, 7, 9, 10, 11, and 12. Where we can say yes, okay, the first 3 pairs, 8, 9, and 10 were, of the false rib were vertebral chondral. Clear? And then the last 2 pairs, 11, 12, were the floating ribs. Did you guys get that?
Yes.
Good. Any questions about your ribs? Now, just one last point, guys. Let me just go here. Okay, good. Where we can mainly say it's okay that, okay, then we have a rib above. And we can say it's okay, we have a rib below. Now the space in between these 2 ribs here is going to be referred to as the inter, which means as okay was in between. Costal pertaining to ribs space. Is that clear?
Yeah.
Right, okay. So, yes, okay. It's going to be as okay, what we can call as okay, intercostal spaces. Space between, yes, okay, 2 consecutive ribs, one above, one below. Now, guys, just as okay as we may, yes, okay, count on the ribs and say, okay, first rib, second rib, third rib, fourth rib, fifth rib, so on, so on, so on, so on, so on, so on. Likewise, where we also, yes, okay, may have to, yes, okay, count on a number of intercostal spaces. Is that clear? So if we, for instance, say that, okay, yes, just to take a number, this is the second rib, and this was the third rib. Then in that case, okay, this was going to be the second intercostal space. Whereas if we said that, okay, yes, if this was the third rib and the rib below was the fourth rib, then this is going to be as okay, the third intercostal space. If we go on and say as okay, this was the fourth rib and the rib below was the fifth rib, then it's going to be as okay, the fourth intercostal space. Did that make sense?
So
So
the
if-
intercostal spaces are numbered 2?
What do you mean intercostal space is going to be number 2?
The intercostal spaces are numbered as well, I mean,
Yes.
like, okay.
But what's going to be intercostal space, my dear? You say it's okay, you had a rib below, above, and a rib below. The space in between those 2 ribs is going to be what you call a intercostal space, right? Okay. Now, if you say that we have these 2 ribs here, just for the hell's sake, yes, okay, this is the second rib that makes the upper border, and the lower rib below is going to be the third rib. This is going to be, yes, okay, your second intercostal space. Okay. Well, let us do it from the beginning, my dear. Look, if the top rib was the first rib, Then the rib below is going to be your second rib, right? Okay, so this will be your first intercostal space. And what do you call a space above the rib or the first rib? That's not going to be an intercostal space because the first rib is your first rib, right? Did that make sense? So any intercostal space, let's just say, okay, we have the 4 first ribs here, 1, 2, 3, 4, for instance. The space between 1 and 2 is going to be the first intercostal space. Space between 2 and 3, second intercostal space. Space between 3 and 4 rib is going to be third intercostal space. So what does that tell you? You can say, pretty simplify, okay. Say that, okay, as the intercostal spaces are going to be numbered according to, as okay, after the rib that forms the upper border of the space. Did that make sense? Okay. Because the space on top of your first rib is not going to be an intercostal space because the first rib is the first rib. Okay, did that make sense?
Thank you.
Okay, so yes, okay, guys, the intercostal space is going to be, yes, okay, you can say. Or yes, okay, the ribs are going to be, yes, okay, important landmarks. Clear? Okay, now you may say, well, okay, how will I feel a rib? And how will I feel, yes, okay, an intercostal space? It pretty much, okay, guys, just goes like this. Rib and a dip, then a rib, then a dip, then a rib, then a dip. Now it's probably easier to just okay feel on a younger fellow in the household. But what you may find is okay that there's going to just okay be a rib, and in between those rib is going to be a dip, and that will be just okay your intercostal space. So you can actually count first rib, then it's okay, second rib in between those, first intercostal space, and so on and so on. Now, guys, it's probably going to be as okay, quite difficult to, you can say it's okay, palpate, or it's okay, feel the first rib. Okay? It's going to be as okay, a bit difficult to, as okay, you can say it's okay, feel the first rib. Okay. But it's okay, it's going to be easy to locate just okay, the second rib, and then you can make just okay, the space above that second rib is going to be the first intercostal space. Because that will be then the space between the first and second rib. Now, guys, do you guys have the energy now to talk about one of my favorite bones, which is the sternum? Or would you like your lunch break first?
I say lunch first, please.
Okay, lunch first. Okay, you can take your lunch break, and I will see you guys, should we say, sharply at 1:55. Is that fair enough?
Yeah, lunch first, sternum second.
Huh?
I
After
said,
that, we talk sternum. Okay, guys, welcome back. Okay, guys. So we were done with the ribs and intercostal spaces, right? Okay. So good. Now we're going to talk about, yes, okay, what we'll call the sternum. Now sternum also, yes, okay, refer to the chest bone. Okay. So this is going to be the chest bone. Now we can actually say that the chest bone, well, okay, although it is one bone, but it can be divided into 3 parts. Known as the manubrium, followed by, because of the body of sternum. Followed by the say people call it, okay, the xiphoid process. Some people may also call it the xiphisternum. Is that clear?
Yes.
Good. Okay, guys. Now a structure which is going to be of an entire, okay, we can say an important anatomy. Okay, it's going to be so anatomically an important anatomical landmark. Is going to, yes, okay, mainly, yes, okay, where we can say, yes, okay, where the manubrium and the body of the sternum meets. This area here, that's going to be called the angle of Louis. Or, yes, okay, it can also be referred to as the sternal angle. Did you guys get that?
Yep.
Okay, so pretty much, okay, yes, the point where the sternal or the manubrium of the sternum meets with the body of the sternum. That's what's going to be called the sternal angle or angle of Louis. Okay, and well, okay, if you run your hand on the top of your sternum, you actually will feel it as a slight bony bump or bony ridge. Okay, so the sternal angle or angle of Louis is going to be felt as a bony ridge or bump on the sternum. Is that clear? Good. Now, we can say, now why is this going to be of importance? Let's say, okay, this is going to be an important anatomical landmark. because guys, okay, yes, on either side of this, okay, the sternal angle or angle of Louis. That's actually is okay where you see it's okay that the second rib will be attached. Did that make sense?
Yep.
As I said earlier, it's okay, it's going to be as okay difficult, it's okay feel or as okay locate the first strip. What it means is okay, you located the angle of Louis, your sternal angle. On either side of that is going to be the second rib, and the dip above that is going to be the first intercostal space. Did that make sense? Whereas guys on both sides, that's okay, up here. That's going to be as okay where you'll find as okay, or the first strip will be attached. And it's okay on top of this. Like this. And we can say, I mean, it's okay like this. That's going to be as okay where the clavicle, which we later on also refer to as okay as being the collarbone will be attached. And what that mainly causes is that okay, yes, that the chop surface of your sternum actually is going to feel like okay as a big tip, and this is going to be referred to as the suprasternal notch. Did you guys get that?
Yeah.
Yep.
Right. So you can do it this way and say, well, okay, here, that's the clavicles. Right here, that's the sternum. And pretty much, okay, due to the clavicles attaching on either side of the sternum, the chop surface of the manubrium of the sternum actually is okay, that's going to be as okay, dip like this. And that's going to be as okay, the suprasternal notch. Supra because it's above, sternal pertaining to sternum, and notch is mean is okay, going to be any dip or depression like that. Here, okay. But it is actually as okay, just make, you can say it's okay, deeper mainly because on either side of the sternum is it that the, yes, okay, right and left clavicles or collarbones are going to be attached. Did you guys get that? Then we had just okay, the manubrium of the sternum. And okay, that's going to be a bony ridge, which we'll call as okay, the angle of Louis or second or sternal angle. And that's going to be as okay, where on both sides, that's okay, your second rib will be attaching. Did you guys get that?
Yep.
Okay. Then we have okay, the major part of the sternum is going to be as called as okay, the sternum or the body of the sternum or the sternal body, whichever. Followed as okay by the lower tip of the sternum is going to be called as okay, the Ziegfeld process, or some people say Ziegfeld process of the sternum, or the Ziphisternum. Did you guys get that?
Yep.
Good. Okay, guys, now let's just take, okay, the, like, okay, as we are looking at the patient or looking at a person from the side. So let's say it's okay that this is going to be the anterior side. This is going to be posterior. Clear? Okay, now remaining is okay, just use the colors that we had here. So we says okay. Manubrium of the sternum. Yeah. The Ziphy sternum. Oh, sorry, the angle of Louis. And then we go and say, it's okay, the Ziphi process. And then we can say it's okay, the sorry, the body of the sternum, and then the Ziphi process. Now, guys, that's okay. Posteriorly, it's okay. What is it we're going to have? The vertebra, right? Is that clear?
Yes.
Okay. Now, what we also know is that, okay, yes, at the angle of Louis or sternal angle, as we may call it, okay, that's good. Oh, good. That's going to be the point where, yes, okay, the second rib will attach, right? Now, guys, that's okay if we go straight like this from the angle of Louis or sternal angle straight back. This is going to come across as okay, or will be as okay, the G4. Which means okay, then will mean that this would be as okay, the second thoracic vertebra. This is going to be as okay, the third thoracic vertebra. So what actually happens is that okay, as the ribs travel forward, they're not going to just okay travel in a straight line like this. Clear? But rather, the ribs as they travel from the back to the front, they're going to just okay go like this and then come up. So although yes, okay, level-wise or anatomically, yes, okay, the second thoracic vertebra is at a higher level in the back compared to yes, okay, where the second rib will attach to the front. Because this sternal angle here or angle of Louis is going to yes, okay, fall at the level of your fourth thoracic vertebra. Did you guys get that?
So the second rib is attached to T2?
Yes.
Okay.
Of course, because first rib is going to be as okay attached to the first thoracic vertebra, right? From each thoracic vertebra on both sides is going to just okay be a rib coming off, right? Did that make sense? Okay. But the sternal angle, or angle of Louis as we called it, on either side, that's going to be as okay where your second rib will attach. Right? Did that make sense? Where did the second rib come from? From the second thoracic vertebrae. Okay? But, and that's why I said, look here, guys, you won't find this in the book. So, but if you draw a straight line, yes, okay, across the chest, that okay, anterior is okay is at the angle of Louis, where okay the second rib attaches. That is going to just okay cross through yes okay your or thoracic vertebra in the back. Did you guys get that?
Yeah.
Good. Any questions?
No.
So yes, okay. This is going to be yes, okay, of importance once we yes, okay, get to yes, okay, because yes, okay, talk about certain structures yes, okay, within the thoracic cavity, especially yes, okay, the heart and the blood vessels that yes, okay, leaves the heart. Let me put it that way. This line here will become yes, okay, very important. Did you guys get okay? But how do we locate that? Pretty much okay, yes, with the help of the sorry. It's okay. Your sternal angle and angle of Louis. Any questions?
No.
Good. Now, just one thing, guys, and let's prove this way and see. Let's see, okay, this was the sternum. You can see it's okay. Yes, okay, that's the first rib. And the first rib is okay, and the back is okay, came from, or we could say it's okay. T1, right? Did you guys get that?
Yeah.
Yeah.
So that's the manubrium to T1. Like the rib.
Yeah. So this is that's okay. This was our first rib. Did that make sense?
Yeah.
Good. Not just the one. Okay. Okay. And RVS, okay, will have on okay as on most of these vertebrae here will be like this. Okay. But the thing that I made as okay, just will bring up is that in some patients, on some cases, okay, what's the vertebra that we have about T1? What would you call the vertebra that's going to be on top of T1?
C7?
C7, exactly. Okay. And that will have, yes, okay, these processes, this process here as well. Okay. So like, okay, so why is that okay for other, yes, okay, thoracic vertebrae and cervical vertebrae? Okay. But what we call is okay, these processes is okay, that project out to, yes, okay, to the sides. They're going to, yes, okay, be referred to as the transverse process. Is that clear? Okay. Likewise, okay, you may say, okay, what about okay the other vertebrae? Okay, they will also have it. So all vertebrae, okay, will have transverse process. But the reason that okay, yes, I brought up is okay, C7 here now is that in some patients or in some people, you can mainly say that okay, yes, some patients or people will have an, should we say it's okay, extended, or we can say it's okay, too long transverse process of cervical vertebra C7. Is that clear?
What happens if it's too long?
I'm coming to that. Okay. And what is it that we will call this extended transfer process of C7? That is going to be known as a cervical rib. Did you guys get that?
Yep.
Okay. So the main, that's okay, just call it a cervical rib. But anatomically, it's not a rib. Okay. We can say, okay, may just mimic like okay, a rib mainly because, okay, the transverse process of your last cervical vertebra is longer than normal. Okay. Now that may, yes, okay, cause problems with, yes, okay, functions and sensations of your hand. Because most nerves that goes from your hands, okay, go and supply, as okay, you can say, as okay, your upper limb, shoulder, hand, I can say, upper arm, forearm, hand, and so on. So are primarily going to come from, yes, okay, the last 4 cervical spaces and the first thoracic space. We can say the last 4 cervical nerves and the first thoracic nerve. Did that make sense? So what this cervical rib actually is okay may do is put pressure, maybe because you can say, okay, the nerve is actually, that's another runs are actually going to be compressed between the actual first rib and is longer than normal cervical or transverse process of C7. So it may actually is okay, put pressure on the nerves. And okay, the patient will start okay having problem with his or her hands, arm, and so on. So in some cases, it's okay, it's just okay as a longer than normal. In some cases, not every case. Okay, but that can be okay. They may first think, okay, maybe the person has okay as a prolapsed disc or something like that is okay in the neck. No, it may not be that. It can just be it's okay, what do you call a cervical rib. There's actually this okay, the transverse process that is too long and actually it's like it puts pressure onto the nerves. Did that make sense? Okay. Any questions? Now, guys, in the next module, that's where we is okay. Briefly may talk again is okay about cervical rib. Okay. So if this is a real rib, no, it's not a real rib. Is it a false rib? Well, it's not even a false rib. It's just, okay, yes, a fake, make, pseudo, moodoo, falsy, malsy rib, mip, pip. Okay. Okay, guys, so yes, sternum, one of my favorite bones. Now, if my drawing is okay, if you didn't like that one, okay, you can always look at this fellow here. Can you see this one?
Yep.
Yep.
Good. Okay, guys, so what do we see here? This red bone here, that's your sternum. Let's take a closer look. This whole bone here is, okay, that's the sternum. This green part here, the manubrium of the sternum, the body of the sternum, and the Z5 process. What do we find between the manubrium and the body? The sternal angle or angle of Louis. And what do we see? That's where it's, okay, the second rib. So this is your second rib. This one here is, okay, that's the first rib. Okay, so this is your second rib attached onto the manubrium of the sternum anteriorly. But if you went straight back with a chainsaw or whatever, okay, that would mean, yes, okay, just go through, yes, okay, your fourth thoracic vertebra. All you can say is, okay, this here is your second thoracic vertebra. So that would be the third right here. And here would be your fourth thoracic vertebra. Did that make sense? Okay, so
Yeah.
this here is, okay, the first thoracic vertebra. This one here, so first thoracic vertebra, second thoracic vertebra. So that's okay, that's where your first rib comes off, second rib comes off. And they say, is, okay, if this up here, or this one here is, okay, that's the transverse process of your cervical vertebra. If that is longer than normal, it will put pressure upon us, okay, the nerves that was going to go to the, okay, at least it's, okay, the seventh cervical nerve. I was going to say, okay, go to supply signals to your arm, and, okay, let's bring signals from the arm. Did that make sense? Okay, but then you can say, it's, okay, 1, 2, 3, 4, 5, 6, 7. Vertebrosternal. Then you go as, okay, here we can only see the 8th. So that's, okay, came out from the 8th thoracic vertebra, but anterior is, okay, that edges to the cartilage of your 7th thoracic vertebra. So it's going to be as, okay, the 9th and 10th. And lastly, but, okay, here you can see, that's, okay, these two last thoracic vertebrae, ribs here, are floating. They only attach to the posterior side. The anterior side, well, okay, is not really attached to anything. Did you guys get that?
Yes.
So that was your appendicular, not appendicular, sorry, axial skeleton. How was it? Good. What do we call this bone here?
The mandible. temporal.
No.
No,
Beep. What is the sphenoid?
sphenoidal.
Okay, good.
Ethmoidal?
Nope.
Lacrimal.
Nope.
Okay, never mind.
What the hell is all this? Don't you see this big thing here?
Nasal.
Nasal bone. Nasal bone. Then you have the lacrimal bone. Then deeper in here, yes, okay, do you have the ethmoidal? And then come, yes, okay, the sphenoidal, right?
Your fingers were in the way.
Guys, do you know what I used to be back in school? Med school. For the first 2 years,
What?
I used to be Jack. And you guys are going to say, who the is Jack? That's okay, that's the model. So that's okay, not catwalk model, but that's okay. My teacher will use me to demonstrate the anatomy. You say that's okay, at least surface anatomy. Okay, that's fine. So, okay. C, kappa B. Okay, guys, should we try to start off with appendicular skeleton?
Yeah.
That's the spirit. So the appendicular skeleton is going to have also okay, a total of 126 bones. Okay, now guys, please don't get scared. It doesn't mean that you have to remember 126 different names because, of course, all of these bones here are going to be paired. Right? Okay. So you will go, okay, does that mean that, okay, as we will have to remember as, okay, a total of 63 names? No. Because a lot of bones are going to go under common names. Is that clear? Okay. So that's going to be okay. A hell of bones that's going to go under common names. But if we just talk about it, okay, the appendicular skeleton, it can be as okay be divided into two major parts. We can say as okay now some people may call it as okay the pectoral girdle. Some people may call it as okay the shoulder girdle. And okay, as to that is going to be as okay bones of the upper limb or upper extremity. Where we can say as okay, the next would be the pelvic girdle. And okay, guys, it's okay to that is going to be as okay the bones of the lower limb or lower extremity. Did you guys get that? Okay.
Yep.
Now, guys, the bones of your pectoral girdle or shoulder girdle, if that's what you call it, is made as okay, there's going to be two bones. So this is made as okay, going to be constituted of two bones. One is what we commonly as okay, one is what we actually as okay, technically we call as okay the sorry. Let me just be the clavicle. Right, okay. One is going to be the clavicle, which we commonly as okay call the collarbone. Okay. The other bone of just okay, the pectoral girdle is going to be as okay what we call the scapula. SCAPULA. And that's what you in common words just okay we'll call it as okay the shoulder blade. Did you guys get that?
Yep.
Yep.
Okay. Now, guys, if you just take a second, let's see that this was the sternum. Or you can say, okay, the manubrium of the sternum. Now, medially, or we can say, okay, the medial end of the clavicle. Or the medial end of the clavicles are going to, yes, okay, attach to the sternum.
You said the medial ends?
Exactly.
Okay.
If this is your clavicle, right? And we said that, okay, this here is, okay, was your manubrium of the sternum, right? Then we could maybe say that, okay, this here is, okay, that will be the medial end of the sternum, right?
Yep.
Or medial end of the clavicle, sorry, right? So the medial end of the clavicle was going to just, okay, articulate onto the sternum. Or if you just look, here. Can you guys see this diagram here? A picture?
Yeah. Yep.
Right, okay. Now we say this is your clavicle or collarbone, right? Right?
Yes.
Good. So we can be sure to say as okay, the end of the collarbone that yes, okay, joins with the manubrium is going to be the medial side, or medial end of the collarbone or clavicle, right?
Yep.
Good. Whereas you can then see here is okay that the lateral side of the collarbones or clavicles that is going to just okay articulate with what comes as okay your shoulder blade or scapula. Okay. So we can say as okay. We said that okay as the medial side of clavicle. Yes, okay. Joins with the manubrium of sternum. Whereas we can say, yes, okay, the lateral end of clavicle. That's okay, joins with the scapula. But this whole thing here is okay, that thing, yes, okay, makes what we'll call the pectoral girdle. Okay, and it's actually as okay going to be as okay to this pectoral girdle here. Actually, it's okay to the scapula. That okay, yes. You mean yes, okay, we'll find that okay at the bones of the upper arm, upper limb, or upper extremity will be attached. Is that clear?
Yeah.
Clear. Now we can mainly say, okay, if we want to do it this way, we can say, okay, that the upper limb, yes, okay, is going to be, yes, okay. We will have upper arm. Now, guys, in the upper arm on each side, there's only going to be one bone. And that's the one that I usually is okay call the funny bone because it is the humerus. Is that clear?
Yep.
Good. Now, guys, in what we call the forearm, beyond your elbow joint or beyond the elbow, right? Okay, that was what we call the forearm. Now, guys, in the forearm, we're going to have there's going to be two bones. So there's going to be two bones in the forearm. Is that clear? Now, please keep in mind, guys, this is a person standing in the anatomical position. And that's pretty much okay why we are okay at a set position that we call the anatomical position. So here's okay, this orange bone. Yes. That's okay. That's going to be that's okay. The lateral bone, and the lateral bone of the forearm is going to be called the radius. Is that clear? So that's going to be the
Yes.
lateral bone. Whereas, okay, yes, the other bone, which is going to be this one here, of the forearm is going to be called ulna. Now the radius, which was the lateral one, and this is going to be as okay, then we can say it's okay, the medial bone of the forearm, because it falls on the, it's going to be on the medial side. Did you guys get that?
Yep.
Yes.
Any questions?
Nope.
Nope. Now, guys, after this, are we going to have, okay, yes, or we in? Let me just take this off for a sec. I may not catch that anyway, so we'll check that up tomorrow. Okay, I'll make common refer to that as the wrist. Or we can say, okay, that's going to be, yes, okay, what we call carpal bones. No, actually, guys, okay, that's going to be, yes, okay, a total of 8 carpal bones. Mainly, yes, okay, arranged like, okay, yes, in 2 rows like this. Is that clear?
Yeah.
Good. Now, as far as the names of these 8 carpal bones here are concerned, as far, okay, what's the lateral most in the first row, second, third, fourth? Tuck, tuck, tuck. What's the sequence of the, yes, okay, bones in the second row and the distal row? Hakuna Matata. So that may sound like music to your ears, because what does Hakuna Matata means?
No
Means
worries.
no
We don't have to
worries.
know
No
them.
worries, so don't worry about them, okay? Okay, so whenever I say it's okay, this thing here is okay, Hakuna Matata, don't worry about them. But I would like you guys to know that, okay, as we call them, what do we call them?
Carpal bones.
Carpal bones. As far as their names are concerned, Hakuna Matata. Okay. And some of you say, it's okay, what a wonderful phrase. Because it's okay, it is okay. Okay, so yes, okay, we took off 8 names here. Or yes, okay, those 126 bones. Yes, okay, 16 bones names are disappeared in the blue ear. Did you guys get that? So the only thing you need to know is that, okay, they're called carpal bones, and there's a total of 8. Capiche? Now, guys, anatomically, they're right here in this area here. So me is okay, just 2 columns off, or 2 rows, sorry, off. Yes, okay, 4 bones in each row. There are some, okay, as weird shapes and so on. So that's fine. And okay, so is the names. Now, guys, what we mainly is okay. Now, I may as okay just take it up here. See, it's okay. Oh shit, that's probably too big. Okay, so we said okay, we had. That says okay. 8 columns of our, sorry, 8 columns, okay. 2 rows with 4 bones in each row. Clear? Okay. And just yes, okay, make it clear that we will say, okay, yes. This is going to be associated lateral side. This is going to be a medial side, just as we had here. So, okay, this was the lateral side. And this was the medial side. Okay, guys. Now, what remains is okay. I'm just going to have yes, okay. After the carpal bones is going to be yes, okay. What we in this case here will call metacarpals. So we are going to have a total of 5 metacarpals. Yeah, the Armenians, okay, just called metacarpals because it meant beyond carpals, which were these bones here. And that's going to be, guys, that's okay, a total of 5. Did you guys get that?
No.
Look, grandma house, chalo. Ami house, go. Okay, that's all right. Sorry. Yeah. Okay, guys. Okay, so here, this, and this. Derby is okay, where you have your metacarpals. Did you guys get that? Okay, so pretty much you can say, okay, 1 metacarpal is okay towards each finger. Okay, but you can say, okay, that's mainly going to be okay, your main bones of the hand will be the metacarpals. Bish. Oopsie moopsie. Because, okay, what we got next is the next set of bones, which will be referred to as the what the hell? Okay. Now we may call them phalanges if we take them one by one, or together, sorry. Single is going to be as okay, phalanx. Okay. Now, guys, this area is going to be as okay a little bit different because okay, we will have a total of 14 phalanges. Is that clear?
Yep.
Good. Now, guys, please keep in mind that, okay, yes, when you're standing in an anatomical position and the palm facing forward, well, okay, yes, on the lateral side, that's actually going to be, yes, okay, where you will see, well, okay, this will be your thumb. Whereas on the medial side, that's where you're going to have your, you can say it's okay, the pinky or little finger, right? So as far as the phalanges for your thumb is concerned, there's only going to be 2 phalanges. Whereas for your other fingers, three phalanges per finger. Is that clear? So that becomes 3 times 4 is 12 plus 2, 14. Okay. Are your phalanges, or you can say your thumb only got 2 phalanges. One phalange, another phalange. Whereas for the other fingers, 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Did you guys get that?
So
Okay.
if 4 of the fingers have a proximal, a distal, and a shaft, the thumb just has.
No. Why do you say shaft?
Wasn't the shaft the middle?
No, that would be the middle.
Medial?
Middle.
Middle.
M-I-D-D-L-E.
Okay, so then
Not medial.
what is the thumb doesn't have that?
The thumb will only have a proximal one
Mhm.
and a distal one.
Okay.
Because there's no one in between, right? Okay. But here you can say, okay, all these here will be the proximal phalanges, right? These will be the middle phalanges. Where this will be the distal phalanges. But for your thumb, well, okay, there's only 2. So this one here is okay, will be the proximal phalange. This one will be the distal one. There's no third one, right? Or there's no phalanx between the proximal and middle and distal one. So in your thumb, you don't have a middle phalange. Did that make sense? Okay. So here is okay, we can say that all these phalanges here is okay, there will be the proximal phalanges. Clear? Whereas, okay, yes, all these one here. So even for the thumb would be, yes, okay, the distal phalange, right? Okay. But it's only going to be these fellows here. That will be just okay, the middle phalanges. Please, guys, it is middle. The regular English word, middle. It is not medial. So that made the bones of your pectoral girdle and upper extremity or upper limb. So the clavicle and scapula is your pectoral girdle or shoulder girdle. Bone of your upper arm, the humerus. Bones of your forearm, where you have two bones, respectively, as okay, the radius, which is going to be the lateral bone, and so the ulna, which is going to be the medial bone. Clear? So that's going to be as okay of your forearm. Clear? After which, 8 carpal bones, which names you do not need to remember. After that, we have a total of 5 metacarpals. Clear? After which we had a total of 14 phalanges. That's going to be the thumb that only got 2 phalanges. One will be a proximal, distal. Whereas for the other 3, 4 fingers. Index, middle finger, ring finger, and pinky. We have 3 phalanges each. That the first one, the one closest to the metacarpals, will be the proximal phalange. The one farthest away will be the distal phalange, and the one in the middle between the proximal and distal will be the middle phalanges. Or guys, as you see here. Now just keep in mind that as this is just the opposite. So it's this here is the lateral side. This here is the medial side. So these are going to be your carpal bones. This is the metacarpals. And then this is the proximal phalanx of the thumb. This is the distal phalanx of the thumb. Whereas, for each other finger, index finger, middle finger, ring finger, pinky, proximal phalanx, middle phalanx, and the distal phalanxes. Did that make sense?
Yes.
Any questions? Okay, guys, so tomorrow we'll check off, the pectoral girdle, now pelvic girdle. Clear? Now, guys, if you understood the anatomy of the upper arm, upper limb, as you may call it, the anatomy of the lower limb is pretty similar. It's just different names for some of the bones. Some of them. And some of them are going to go with the same names. Okay? Okay? So please make sure that, as you read on, your bones of your upper limb today. Not to, forget about, the bones of the skull and face and the sinuses and all the. But then don't worry about the Hakuna Matatas. Okay? Good. So tomorrow we talk about, the pelvic girdle. We will talk about, the bones of the lower extremity. And then we will talk a little bit about joints. And then we will finish with this chapter here. And then we can, use our lower limb or lower extremities to take, big step by the humans, and maybe an even bigger step for humanity, because we're going to jump over some chapters and go to some later chapters in the book. Okay. So see you guys tomorrow with fresh energy. Okay, guys, have a blessed day and stay clear.
See you tomorrow.
Bye.
Take care.